Today we're going to be talking about convergence insufficiency, and it's what it sounds like. It's an insufficiency of convergence. So vergence movements go the opposite direction. Vergence versus version. So version is the same direction. So when you're looking to the right or to the left, those are versions, two eyes moving together. When it's one eye moving, that's called adduction, abduction, adduction, superduction. But this vergence, and there's two types, convergence and a divergence. So convergence, divergence. So the reason you need to converge is when you're looking at a target at near, your two eyes have to accommodate for the focal length change, and that accommodation is in the lens of your eye. But you also have to converge so you don't get diplopia. So that convergence requires that the medial rectus have tonic activation to look at the target. And so the defining feature of convergence insufficiency is an exotropia, the eyes turned out, exotropia, and it's going to be at near, and we use that prime symbol to denote that that's the near. So the xt prime is greater than the xt at distance. In fact, often it's only an xt at near. Convergence insufficiency happens in a lot of people. As you just get older, your fusion breaks down. And so I have convergence insufficiency. It's a super common thing. It doesn't by itself localize anywhere. And any disease can cause convergence insufficiency. It doesn't matter what it is. The neurodegenerative disorders, a lot of the patients have convergence insufficiency. The most prominent, of course, is the Parkinson's disease. But patients with Alzheimer's disease, any kind of neurodegenerative thing, will have convergence insufficiency. It's our most common cause of diplopia at near in the hospitalized patients, even if they're hospitalized for something that's totally unrelated, heart attack, gallbladder resection. The reductions and inversions are going to be full. You're going to measure the exotropia with the prism cover test at distance and near. If it's greater at near, that makes the diagnosis, convergence insufficiency. The treatment, you could just wear a patch. We could use prism. We have orthoptic exercises, and the at-home versions are the pencil push-ups, but there's also computerized versions to get the convergence going. And if it doesn't work, strabismus surgery. So you need to know a little bit about convergence, insufficiency, and exotropia at near, greater than distance. Reductions and inversions are full. Non-localizing occurs in a whole host of disorders, but especially the neurodegenerative disorders, and just with age, patch, prism, exercises, and if necessary, surgery.